Okay, good afternoon, everybody. This is Daniel Van Sant speaking, the Director of Disability Policy at the Harkin Institute. We still have some people coming in, so welcome, welcome. As you will just have heard, we are recording this session. So while you're obviously free to take notes and things like that, we will have a recording posted for you to share and to watch again in the future. I want to welcome everybody to this webinar and wish you all a very happy Disability Pride Month. We're in, the last couple days here of July, which, as you know, is Disability Pride Month, celebrating the 35th anniversary of the Americans with Disabilities Act. So this webinar rounds out the Harkin Institute's month of activities, and we're all excited that you joined us here today for that. As a little bit of housekeeping, I already mentioned we are recording this session. So if you do want to stay off camera or change your name or anything, please handle that how you see fit and know that there will be a recording made available for people to access later. We have captions. We have a CART transcriber for this webinar. So if you are not seeing captions, you'll want to engage the captions below to make sure that you have them running. I do want to let everyone know that we will not have time for a live question and answer today. We have a lot of information to get through, and we're excited to demo this platform. And unfortunately, we'll not be able to do questions, but we will give you our contact information to reach out after the fact if you have questions, ideas of how you might be able to make disability statistics work for you. So I will introduce my co-presenters here on our next slide. I've already introduced myself. I'm Daniel, the Director of Disability Policy at the Harkin Institute. If this is your first time interacting with the Harkin Institute, we certainly hope it will not be your last. And so we have activities, webinars, speakers, trainers, events on disability policy and other topics throughout the year. Please feel free to engage with us. We are a nonpartisan, nonprofit think tank based at Drake University in Des Moines, Iowa. Joining me today are Bill Erickson and Camille Lee, both from the Yang Tan Institute on Employment and Disability at Cornell University. Bill is a senior researcher, and Camille is a web and media lead. So thank you, Bill and Camille, for joining me and all of us today. We'll go now to our agenda. So we're going to talk about disability and data and disability statistics. So I think just as a very brief means of introduction, certainly for many of you in this field, you've noticed or struggled with how data and disability work and some of the challenges that we run into. So our speakers will be talking a lot about the American Community Survey or ACS data. So when you hear us say ACS, you know that that's American Community Survey. But really, what we're trying to solve with this webinar is introducing everybody here and people watching the recording later to a tool that will help you utilize ACS data in your disability work. I think we're all familiar with sometimes this problem of disability being presented anecdotally or through stories, and statistics and data can really help us flush out some of those qualitative approaches with a quantitative backing and support. But depending on how you define disability, how you ask questions, what source you're looking at, we might get different answers, different responses on how many disabled people are in an area or what types of disabilities are affecting certain populations. So to try to address this inherent challenge in data and disability, we're excited to collaborate today with the Yang Tan Institute to present the disabilitystatistics.org tool. So I will pass the virtual microphone now to Camille to introduce a little bit more about their work and the tool.
Hello, everyone. My name is Camille Lee, and I lead the web and media team at the Yang Tan Institute on Employment and Disability. We are located within the ILR school, which is the School of Industrial and Labor Relations at Cornell University. And this site, Disability Statistics, is brought to you by the Northeast ADA Center. The center is located within our institute, and for everyone on the call who happens to be from New York, New Jersey, Puerto Rico, and the Virgin Islands, we are your regional ADA center, providing training, technical assistance, consultation, and materials on a broad range of topics related to disability in the United States. But if you are not from our region, please go to adata.org to find your local region. And the mission of our institute, the Yang Tan Institute, is to advance the inclusion and full participation of people with disabilities in the workplace and community through our research, technical assistance, and training and resources. And one of these resources is disabilitystatistics.org. A little bit of housekeeping for the center before we move on. I do need to make the disclaimer, you're probably all familiar with these, that the information, materials, and/or technical assistance provided are intended solely as information, informal guidance, and are neither a determination of your legal rights or responsibilities under the ADA, nor binding on any agency with enforcement responsibility under the ADA. So thank you for listening to the blurb. So let's get on to the fun stuff. I'm going to hand it over to Bill, and Bill will give you an overview on the American Community Survey and why we use this data source and within disability statistics. Bill.
All right. Thank you, Camille. Welcome, everyone. As Daniel mentioned, most of, or pretty much all of the statistics we'll be presenting in today's webinar are based on the American Community Survey, the ACS. Next slide, Camille. So why the ACS? And what is it? So it's an annual U.S. Census Bureau survey sent to a sample of about 3.5 million addresses in 50 states, District of Columbia, and Puerto Rico. So it's a huge survey. It's only second in size to the decennial census done every 10 years. So it has a lot of advantages because it is so many people. Has a very high response rate, around depending on the state, mid 80% of people who get the survey respond to it, which means that the quality is much better than many surveys. You see responses for internet surveys quite often are about 2 or 3%. So 85% is great, because then you only got 2 or 3%. You got to wonder what the other 97% who they tried to survey, what they thought, as opposed to that really small proportion who responded. And the ACS is designed to provide current information to communities each year. It's designed to be able to provide good estimates on a yearly basis. Next slide, Camille. Okay, so why do we use the ACS? One of the main reasons, it includes the 6 disability questions. Back in the day, even just one disability question was remarkable. And 6 is actually, it's not as many as many advocates and some of us researchers would like, but it's a lot better than 1 or none. It covers a wide variety of topics, including employment, measures of poverty, occupation, housing, income. So it covers a wide range of topics that are of interest when you're looking at disability and understanding what the situation is for people with disabilities. It's used a consistent measure of disability over time since 2008 through 2025. We'll be asking the same questions. So it allows you to be able to look at estimates over time to see if they've changed and not worry about, okay, they changed who is defined as being a person with a disability. That's a real advantage there. And the other thing is that because it is such a large sample, it supports local level estimates, which is huge, because most people, they're interested in the perhaps the national level, but they may want to be really interested in their own city or their county or whatever. And the ACS can actually support those kind of estimates, and there really aren't any other data sources that can do that. So it's incredibly useful. And then you can also compare your county to the US or to the state. So that can be really helpful. And we'll be doing some of that today, showing how to go about doing that. Okay, next slide, please. Okay, so that begs, comes to the next question. Okay, it's disability. What does that mean? So in the ACS, any disability is someone who reports one or more of the 6 disability types, and we listed them here. And I just wanted to read real quickly through the questions. So this is a survey that goes out to the households, and people are responding to them for themselves as well as for all the other members of the household. And so the visual disability, it's a question asking, does this person is blind or has serious difficulty seeing even when wearing glasses? A hearing disability, basically if the person is deaf or has serious difficulty hearing. Ambulatory disability, which is only asked of individuals ages 5 and older. This person has serious difficulty walking or climbing stairs. A cognitive disability, again, only asked of older people ages 5 and older. Because of a physical, mental, or emotional condition, does this individual have serious difficulty concentrating, remembering, or making decisions? Note that this does not include actual any sort of if a person has like depression or some sort of mental illness, it does not capture that. It's really focused on cognition. And it also doesn't include explicitly learning disabilities. So these questions aren't perfect, but these are what we're dealing with here. Self-care disability, so if the person has difficulty dressing or bathing. And finally, independent living disability, which is asked if person's ages 15 and older. Because of a physical, mental, or emotional condition, does this person have difficulty doing errands alone, such as visiting a doctor's office or shopping? So it's just really important to be aware of how disability is actually asked, because once you start looking into the questions, you can understand, okay, how might a person respond to this? Who might respond to it? Who might say no? So it's just important to understand the questions, and we document that very thoroughly on the website. I'll show you where you can find the detailed questions. We try to present them up front there, so you've got the information you need to understand exactly who are we capturing and who may not be included under this ACS disability definitions. And again, people can respond to one or more of these. So you can't just add in question, you can't just add up the categories and come to a total number of people with disabilities, because you'll be double, triple counting potentially individuals who have, who report more than one disability. Typically, people of working age, 21 to 64, about half of people who of working age who report a disability report more than one disability type. So just be aware of that. Okay, next slide. Okay, so we're basically on our website, we're presenting 2 different kinds of ACS estimates. One are what we refer to as the custom estimates, and those are based on just a single year of data, and they're estimates that I actually generate myself using the public use microdata sample. It's basically actually individual lines of, an individual responded to this all the hundreds of questions in the ACS, and I'm able to use that information and create my own estimates covering a wide variety of topics. One of some of the benefits of using these particular estimates, they're best for sort of usually for national and state level estimates. It's based on the most current data available. Currently, we're working with the 2023 American Community Survey data. The 2024 data will be released in the fall. Basically, they collect all the data they collect data in the ACS throughout the entire year from like January 1st through December 31st. Then the Census Bureau pulls it all together, cleans it up, makes it correct, and then it makes the data available for us. So it takes a few months before that data is actually ready for us to do analysis of. And the other advantage of the custom estimates, as I mentioned, there's since we can look at all the topics that are available in the ACS. We do have a limited number of topics we do look at, but it allows us to be more flexible, because we can decide, okay, this is the age group and this is the topic we're interested in. The Census Bureau tables, which I'll be talking about next, are more limited in terms of their scope and topics. Okay, next slide, please, Camille. So the other types of estimates we present on the site are the ACS Census Bureau estimates, and those are based, the ones we're working with are based on the 5-year estimates. So what it is, basically, it's data that's been collected over a 5-year period. So the 2023 5-year estimates use data collected from, actually, it's 2019 to 2023. So it's estimates from that. So that instead of a 1 year's worth of sample, you've got 5 years. So a much larger sample. And that allows the Census Bureau to generate estimates for small sub-state areas, such as all the counties. I'll be talking about that in just a minute. The downside, the topics are more limited. And for better or worse, it combines 5 years of data. And again, I'll get into a little more detail in the next slide. Okay, so again, why the 5-year estimates? The 1-year estimates are only go down to population areas of 65,000, which sounds like, well, that's, not, well, it's a number of people, right? Just to sort of put that in perspective, only 680 of the 3,145 counties in the US meet that criteria. So if we were to just work on the 1-year estimates, we'll lose 80% of the counties. So that's why we're working with a 5-year estimates, because you can actually get all of the counties and all of the congressional districts, and we'll eventually be providing data on individual cities and towns that that the 5-year estimates are available on. The downside is that it's not as timely and current. Next slide, Camille. So as I mentioned, okay, the 1-year data, we're talking, again, you're talking just the data collected in 2023, which is great, especially if you're looking at things that change over time, like employment, right? That may be going up, going down over that 5-year period. So for the employment rate, for example, if you look at the 5-year estimate for employment, it's a 41.8% employment rate over that 5-year span. If you look at the 1-year 2023 estimates for that same population, it's 46.5% employment rate for actually 2023. So averaging over time has some issues on with certain measures such as employment and poverty and all. So there are upsides and downsides. You can dig much deeper geographically in the 5-year estimates, but some of the estimates such as employment, there's a little more flexibility because you're looking at a much longer span of time. Okay, next slide, please. All right, so next we're going to start digging into some of the data here. And I think Daniel might have some scenarios for us to walk through to give you some examples of what you can do on the site here. So I'm going to go and share. I think I need to be able to share my screen.
Yeah, so this is Daniel speaking, while Bill is setting that up, we have prepared some scenarios. So Bill and Camille are going to walk us through 4 different scenarios we've got here based on real questions and scenarios that we get at the Harkin Institute. Of course, we've changed some details, but these are all real situations that come up that people ask us for data about. So, Bill, if you're ready, I can queue up my first scenario here.
Sure. Actually, Daniel, before you start, let me just do a quick walkthrough, just so I realize we're not.
Sure.
So this is disabilitystatistics.org, our website, and this is what the homepage looks like. We'll be walking through the stats in just a moment here. So we do have help options here. So we have, just so you know, have a user's guides, or tells you how to get started, talk about the data sources, some of the topics, quite a bit of information here, information about how to use your account and how to register an account. So we really recommend people register so they can get any updates that are occurring. We can send announcements as we add new data. And also, if you wanted to send a question, what we present here, the amount of data, it's literally tens of millions of estimates, but it isn't everything that could be provided, and we don't cover all the disability types. If you see something that, well, I'm really interested in this particular disability type or this health condition, I can't find it here, you can send me a question and I will respond as quickly as possible. I've responded to literally, thousands of technical assistance requests over the past 20 or so years I've been doing disability statistics. So that's one way you can get in contact with me. Send me a question, and I will get back to you as quickly as possible. Uh, yeah, and staying in touch and all. So this is some of the information there. Uh, so there's also under help. There's also a glossary which I'll walk you through, and also FAQs, frequently asked questions. Okay, so let's go back to stats and to Daniel.
Great. This is Daniel speaking again. So, Bill, I am going to Washington, D.C. in a couple weeks to meet with the Iowa delegations, right? Our senators and representatives from Iowa. And I want to make sure that I can prepare a leave behind document. So I want to pull some information together that I can really give to our elected officials to inform them about how policy decisions they make affect disabled people in Iowa. So I'm hoping you can help me with that. I'm really looking to give them probably four pieces of information related to our advocacy. So I need to tell them how many disabled people are in Iowa, the employment rates of people with disabilities in Iowa. I would inside that I would love to show how many unemployed disabled people are looking for jobs. And then I want to show health insurance coverage, Medicaid rates, things like that. Um, can disabilitystatistics.org help me with those four topics?
We can. All right, so we're going to go to stats here. Okay, so you talked about prevalence. So these are the different categories that can be accessed. So we have the 5-year estimates,
Hmm.
and then we have the custom 1-year estimates. Since you were, specifically interested in state level estimates, we're going to go with the 1-year estimates for prevalence. Um, so what will come up here initially is a US level map, which is kind of cool. It sort of shows you, okay, where the higher and lower, proportions of people with disabilities, prevalence rates. You can see Kentucky and West Virginia very high. So now if you're looking for Iowa specifically,
Mhm.
and you probably are interested in and maybe different, prevalence by different disability types as well, perhaps.
Yes. Yeah, that'd be great.
Okay, so the second step you can do is select a map or charts, and got a whole bunch of different variations here. So let's go to by disability type. And since this is again, we're still looking at United States, so let's select the geography. All right, so go to Iowa. All right, so typically, yeah, so one of the great things about the site is it tends us to remember what you did last, and I've been playing around with this. So I'm sort of resetting it to the way it will show you normally. So it normally would go to using these filters, the most recent year, and male or female, all ages, races, all educational levels, regardless of ethnicity. So okay, so this is disability prevalence rate by disability type in Iowa. Now, since so there's a 13.3% of
Mhm.
individuals, non-institutionalized males or females with disability of all ages, all races, regardless of ethnicity, all levels of education. So this little title thing, it's kind of clunky, but it tells you exactly what you're looking at, which is important. Now, since Daniel, you were talking about you were interested in employment. So generally, what we like to do is limit it to that's typically the group that's most likely to be working, which we generally look at saying ages 21 to 64. So we're going to go down here. Instead of all ages, we're going to select 21 to 64 in the dropdown for age. And as you can see, it's 11.8%. for all ages. A couple things actually. Normally, what this would well, normally, so the default is to go to 100%. So you can sort of see, okay, the rest of the graph is kind of empty. So you can actually select scale to results, and that'll bring things up to the maximum level of the bar of the value there. So it can make it easier to sort of understand what's going on. So this could be sort of a useful thing. So 11.8% of the individuals uh, of this ages 21 to 64 have a disability. As you can see that the highest proportion of disability types is 5.7% have a cognitive disability, and only about 1.3% have a self-care disability. And
Great.
okay, yeah,
So now that I've got this bar graph and it looked like there was maybe a chart of the information below,
yeah,
how so
yes,
that's exactly what I was looking for. Is there a way for me to capture this to share it with Senator Grassley in a couple
sure,
weeks?
yeah. So there are a couple different things you can do here. Try to make it really easy to be able to grab this information and hand it off to someone. One option is you can actually uh, copy the link here because there's just so many different things going on. You can't just copy this the address here because it's just sort of the standard thing. So what you want to do is to copy the link. If you wanted to share this over email or something like that, just copy it and you can send it to your senator if you wanted to. You can just paste it in and voila, you got exactly what you found. You want to share it? Here you go. This is the data online. If you like this chart, he's like, I really want to include that in a report.
Hmm.
You can just click the download visualization. Click on that, it comes up. And your downloads, you can double click it. Here it is. If you can actually just copy that document there and open up a Word document and paste it right in. And so if you've got that in your document, so that's a real easy way to share that. Let's go back to the thing. So if you wanted to actually, download the numbers in the table because you want to, be able to look at these numbers really closely, yeah, we provide a bunch of different options here. So there are only 1 to 7 entries here, but so if it was like a whole list of states or list of counties, you want to show all entries, and then what you can do, you can either download a CSV file or as an Excel file. So that's just to do download the Excel file. I'm just, all right, it's downloaded. Click on it. And it comes up here, which is probably
Awesome.
almost impossible for people to see. You've got all the information here. It has the information. It actually states in the file name that it's by disability prevalence by disability type in Iowa. Uh, there's the second line here provides all the information about, to get that title, that information about exactly who you're looking at.
Hmm.
It provides a source and a citation and all the information here. So it's a really easy way to just grab this. One of my pet peeves, the Census Bureau, you can download things sort of like this. Pet peeve is that their numbers don't come through Excel as numbers. You have to actually change the format. And it drives me crazy because you can't add up the way they come in there. So it's just an extra step that we try to make it easy. You don't have to do it. Okay, so we got
Great.
a
So I
couple.
wanted to double check. You mentioned that when you downloaded that Excel, that it actually generated the citation
Yeah,
along
so
with
the
that
citation
chart,
is
right?
actually in the top of the yeah. So we've got the citation right here.
So that way, in my meeting in a couple weeks, if they say, where did you get this data from? I've got the citation right on that document. There's no question of where we pulled this and when, which is
Right.
great.
Yeah.
That's awesome.
Yeah. And actually, Camille, I guess one thing we thought about is probably should include the link to this if we can somehow figure out how to do that. as well.
Sure.
Yeah.
Um,
I've also been told this citation is not the most modern way to do a website, so we will be updating that as well. This is a place to interlude. This site is in active development all of the time. So we will be continuously making little improvements as we get notified by people.
Like all of us, actively in development, making continuous improvements. Um,
so,
great. So I know we have short time here. I wanted to jump to some of the other topics, Bill. If
yep,
you could show
yep,
me the employment data in
sure.
Iowa
Yep.
for disabled people.
Okay, so we could just hop down to employment here on the 1 year estimates. All right, and since we were already displaying it by disability type, here it is again. You can see about 54.7% for any disability. The highest employment rates are for people with hearing disabilities. Uh, so there's the bar chart. Again, we have the table. We also provide a description of statistics. So if you're wondering how to fit this into your report, how do you describe it? We've provided that both, the prevalence sort of description
Mhm.
as well as a numerical description here, and also have information about, sample sizes of margins of error. And as mentioned, also, we have a definition section here, so it covers all the different kinds of disability types. So you got it on this one page, you know who you're talking about, and you can easily reference, okay, this is who we're actually speaking with, and also a citation down here.
Great. So yeah, the employment rates by disability look good. I mentioned at the beginning, um, we need to start supporting anecdotal disability statements with quantitative data. So, an anecdote that we love to share here in Iowa is that Iowans are just a hardworking bunch of people, right? The sort of Midwestern work ethic. Is that supported by data nationally? So, could we compare Iowa employment rates for disabled people to national employment rates?
Sure. Yeah. So one of the cool things you can do with our site, how about looking over a period of years too to see if things have
Hmm.
changed much. So what you can do is chart it by year. Okay, and this is what employment
Wow.
looks like over the period of time. You can see it's been going up in the past couple of years since the pandemic. But you're curious about, okay, let's compare it to the US. And you have down here this option, comparisons. You can actually compare to US or a bunch of, any state there. So let's compare to the US and see how Iowa is doing relative to the US. And you can see actually following the same sort of trajectory, very, pretty closely. But Iowa in generally is doing, almost 10% percentage points higher employment rates than the US as a whole.
That's great. Like I said, I would love to support an anecdote with a data piece. A critique I might get is, employment situations in Iowa might be very different than states with bigger cities or more urban areas. So let's make it a little competitive regionally. And I don't want to pick on anyone, but Missouri is one of our neighbors. Can we add Missouri to this data set?
We can actually do up to 7 comparisons. So you can have all sorts of things. All right. So here's Missouri. And just select it and then add comparison and watch the circle spin. All right.
Okay.
So yeah, it's interesting here. You can see that Missouri falls almost exactly on the line of the U.S. As a whole, but again, still lower than Iowa.
So
Well,
may I make a quick note for folks? In the order of the geographies, you see right now we have Iowa first, then the US, and then Missouri. Let's just say that you are feeling very fussy and you want the US first in the list. What you would do is in the selection panel, select the United States. So whichever geography is selected in the selection panel on the left, that becomes the default, that first blue line, just to let everyone know. And then you can add comparisons after that.
Okay, I actually skipped. Go back on here.
Okay, great. Just wanted to show people that option.
So, so the other
Yep.
thing, if you wanted to do, you can actually look at this by, educational level if you're interested in, okay, employment rates by for high school graduates only, or, some people who had college graduate level educational attainment as well.
Yeah. Yeah, so I know I asked you for a few topics there to give to my senators, but I want to make sure we get to the other scenarios with time.
Yeah.
So
Yeah.
are you okay, Bill, if we maybe jump to the next round?
Sure. Yep. Yep. Yeah. This is
Awesome. So we're going to switch things up again. So our second scenario here. Now Daniel's going to switch my hats. Let's say that I am a regional transportation, like a city or regional bus company, and I need to give you geography. So now I've gone a little bit north, and I'm from the Twin Cities, Minneapolis, St. Paul. Our city is looking to expand our bus system, and because resources are finite, we can't just completely spider web across the region yet. I need to decide which direction to build this bus line out and into which county. So if you could pull up some data that would help me there. I need
sure.
to know which counties around Minneapolis, St. Paul have the highest transportation affected disability rates.
All right. So you're wanting to use, as you're looking at local data, you want to be choosing the ACS 5-year estimates, prevalence. Uh, and
Yes.
let's look at, yeah. Uh, okay, let's change to, we're looking at counties here. And uh, actually, by disability type. Okay, and counties, going to go Minnesota.
Minnesota, and I am in Hennepin County because I'm in the Twin Cities right now.
Okay, and Hennepin County.
Now, I know you mentioned that you could compare 7 geographies, which is about how many counties circle me in Hennepin. For sake of time, maybe I'll just have you do a northern county and a southern county.
Okay.
So this is taking a while. That's odd. Bill, you might have to
Yeah.
refresh the page to reset its brain.
Happens to the best of us sometime.
Okay, so you're interested in ambulatory disability.
You're in the map.
Oh, yeah.
Yep.
Yeah. Well, actually, yeah. So since we'll be looking at the table here. All counties, so ambulatory disability. And okay, so we're looking at
Minnesota.
Minnesota. Okay, and we actually wanted to look at, right. So, okay, right. Let's do on page. Sorry. County. So, Hennepin County. Okay, and it's already selected for ambulatory disability. So this is the number of people uh, in Hennepin County with an ambulatory disability. Um, if you're interested in looking at what was the other county? Was there another county? Was it,
Yeah, so I think for sake of time, if I could compare Anoka County
Okay, yeah. So again, Minnesota and Milcom County.
And Carver County, please. Because I can probably only build my bus line out in one direction until budgets allow.
All right, so this gives you ambulatory disability. Now, the one thing you probably want to do, that this is just giving you prevalence rates, which doesn't give you the actual ridership, right? So what you're probably interested in, instead of doing percentage, you probably want to know the number of potential riders. Okay,
Yes.
so now you can see Hennepin is clearly the winner, with Anoka having the second most number of people with ambulatory disabilities. So probably you want to be focused on Hennepin and Anoka rather than Carver, which is a much smaller number of people with ambulatory disabilities.
Awesome. So now if I got questions about why I chose to build the line out to Anoka County instead of Carver, I could download this chart and share that with people to be more transparent with how we came to that decision.
Yeah.
That's super helpful. I think we'll move to our next scenario, unless Bill or Camille, if you can think of anything I forgot on this before I stop being the regional transit authority.
Right.
No? Okay. So switching costume and makeup again. Um, Now I work at a nonprofit, not so different from the costume I wear every day, but I have now moved to Florida. So we're coming to a different geography here. I am a nonprofit in Florida that primarily serves people with hearing impairments or who are deaf or hard of hearing. And I'm working on a grant application, Bill, that I'm hoping you can help me with. We need to apply for a grant to support building either a satellite service center or to buy a van or something to get out to reach people in more rural counties. But I have to justify that there are large numbers of deaf and hard of hearing people outside of the city centers to show why I have to go to certain counties. Could you show me in Florida what counties have higher prevalence of hearing related disabilities so that I could include this in my grant application to show that I'm not just going off of my gut here?
So since we want county level data, we need the census 5-year estimates to
Okay.
get to the sub-state geographies. So we're going to go to the ACS census 5-year estimates and prevalence. Okay. And now we're at the map and we want to see the counties in Florida. So there's two ways you can do this. We are looking at the map right now. So for select map or chart, we're at map. At select geography, if you select counties by state, you will only see the counties when you zoom in. When you zoom back out, you see the state level. If you want to see all the counties and then get the data for all the counties at the same time, you then use the all counties view. So I'm going to just stick to all counties. And if you'll notice, there's a mini map in the corner that shows you where you are in the country. Okay, so what you see here, you see all the counties in Florida. And now we're going to look down below, but the table gives you all of the counties across all of the states. So we're going to need to filter this table. A note to everyone, you're going to be like, oh my gosh, is this how you search by state? Yes, it's a little kludgy right now. Like I said, we will give you better tools. For the moment, in order to filter this table down to the counties for a particular state, we have one way to do this at the moment. Okay, so we're going to type in Florida. And as you type in Florida into the search box, you will see that out of the 3,222 total entries, we are now showing 1 of 10 of 68. If anybody lives in Florida, you'll be like, wait a minute, we don't have 68 counties in Florida. Why is that number wrong? Well, I'll show you in a second. I'm going to select all. and it shows all of the states, sorry, all the counties in Florida. And what you're going to find is we have Florida Municipio coming in from Puerto Rico because it is searching for the word Florida. This search is not smart enough yet to search for a state. It will search for the word. So we're sorry about that, but you can download the Excel file and take out Florida from Puerto Rico when you get down to there. So in the table, now that we have searched by Florida, we have the first column is state, the second column is county, and if you click the entire cell, the entire heading cell, not just the teeny weeny little arrows, but if you hit the entire cell, you will sort the entire cell alphabetically. Um, yes. And then each column afterwards, you can also sort. You can sort by the percentage estimate and the percentage margin of error, or in this case, we do want the number of people. And so it looks like in Florida, Miami-Dade County has the highest number of people of any disability, but we actually want hearing.
Yes.
And make sure that we are both male and female and then all ages. Okay, in that case, I've reset the list and it lost Florida. So let me just type in Florida again and show all entries again. And then we're going to sort by estimate. And it looks like in Florida, the county that has the highest number of people with a hearing disability is Miami-Dade, with an estimated 58,000 people and a margin of error of 1,828. And so I think for everyone who has dealt with margins of error before, and Bill, please jump in because you can explain this far better than I can. The issue is when you're dealing with smaller estimates. So if you have an estimate of 484 people, let's say in Lafayette County in Florida, with a margin of error of 164, then that means that this number is potentially half off.
Yeah. So yeah, basically what it means is they have 90% certainty that basically it's 484 individuals plus 164. So that's about it gives you range. So plus or minus 484 plus or minus 164. So the actual they're 90% have 90% confidence that the actual number lands somewhere between 44 minus 164. So that's what, about 300 ish people up to 484 plus 164 up to around, 600 or so. I can't do math in my head that fast. So it's a pretty wide range there. So there's just be aware of that there's quite a bit of question there when you see a really big margin of error.
And as Bill showed you, you can download this Excel file. And you will see the information. You get the information as you see it in the table, and you will get Puerto Rico as well that you will have to remove. Okay.
So Camille, can you show me the map of Florida then? Because I can download that as well, right?
Well, okay, sorry, not quite yet.
Okay,
We haven't quite gotten the functionality where you can download a map, but that is also on our list of things to do.
got it. But at
You
least
could,
geographically for this application, I can show our office is in Miami and how far the next highest county of prevalence is to justify my grant application is what I'm looking for, right?
Yes, and
I can show the chart with the geography.
yes.
and you could also do a limited screen capture as well on the computer to be able to grab the map also in the view.
Yeah, I think that one of the ways, I'm going back to counties by state, and if on the Mac, at any rate, if I do Shift Control Command, I can take a screenshot and then drop that screenshot into a Word file. So I would imagine if you're on Word, you will have tools similar to this where you can take a screenshot. So at least you have some sort of image. It won't be a high quality image, but you'll have one.
Yeah. No, I mean, as I said, our nonprofit, like many nonprofits in these days, is struggling for funding. We want to have a strong grant application. So knowing that I could include this data in there, and importantly, as you've already told me about that citation, so that if the grantor is asking me where these numbers are from, I can already have that. So, um,
Yep.
right, it's really helpful to have reports, grant applications, research with tables and data and citations. So um, that's great. I'll let you all know how our grant application ends up. But in the meantime, we'll do a quick costume change because I think it's time for scenario 4. Um, where real life Daniel actually used to live. If we have Texans on here, you will know that anyone who has ever had residency in Texas is then legally required for the rest of their life to claim the time that they've had in Texas. So we got to work Texas into the assessment here. Um, so I am an employer based in Texas, Camille, and really my operations are based in Dallas County, which houses Dallas as well as Harris County, which is Houston. We're a pretty urban-based employer. We just did our annual, you know, great places to work survey, and this year we had an optional self-disclosure of disability question. And what I really would like to know is how my employees' disability disclosure rate tracks with disability representation in our local areas to see if my employees are or are not representative of the areas that we're working in. Can you help me with that?
Yes. So since we are
Awesome.
looking at since we're looking at county data, let's make sure that we are at the ACS 5-year census estimates. We're going to go to prevalence.
Perfect.
And now let's break things up by age. So I have gone to the chart by age. And let's just say for fun, we are going to compare Texas and Dallas County and Harris County, where Houston, I believe, is located, with the
Yes.
US. So I'm going to make sure that I've selected the US as the base geography, and we are looking for any disability and male or female. Okay, so now let's add the comparisons. So I'm going to first scale the results so we're not at 100. So we
Hmm.
have a much nicer looking chart. And then I'm going to go to state only, and I'm going to select Texas. And I'm going to add that first comparison. So what we're doing now is we're adding Texas to the chart. There was a question that came in about changing the color of the lines. I would imagine the corollary will be, can I please change the color of these bars? We do not have that functionality yet, but I know that it's something that I would want. So we are definite, it is on our list of things to build out. We will also be providing a high contrast option for those of you who need to provide charts in high contrast as well. Okay, so that's coming, sorry. All right, now we're going to add counties. So now I'm going to select the county in the comparison geography in the state of Texas,
Hmm.
and we want Dallas County for Dallas, and I'm going to add this comparison, and I want Harris County for Houston. And so we see here that compared to the US, Texas and these counties track pretty closely, actually. Just to let everyone know, you'll see here we don't actually have a working age bracket in the chart. We do in in the map, but we will be building that data is actually new as of yesterday. So we haven't moved that to the chart yet, but there will be one more set of bars that will be 18 to 64, so you don't have to deal with this split here, just to let you know. So you can then uh, take a look at the the percentages and how they break out against your company.
Great. And I assume that I can still do all those things by breaking out by disability type and
Yep.
all those other pieces that we've been looking at. So that is as inclusive as we would like to be this Disability Pride Month. Um, so I think that actually gets me to the end of our scenarios, and we are very closely approaching the end of our hour. Um, so Camille, I know you had a couple more slides to put up, and then we will dismiss everyone back to their workdays.
Okay. Let's So, please register for an account. Like I've said a few times, this site is under continuous development. We are releasing new bits and pieces. And when you opt into our email list, when you sign up for an account, we will update you new webinars, new events, new features. We will be building out our account management profiles and systems to help you, to support you when you, for example, if you ask Bill a question, that question will be saved. All of that information will be saved in your account. We will be providing you the ability to save queries coming up. So please go ahead and create an account. It helps us understand who you are and what kind of data you need.
We promise we won't
And
bother you with lots of emails.
no, 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 we don't. Uh,
Not the point.
Sending out emails is a lot of work. So we have approximately three webinars a year that are planned for disability statistics. Our launch of the 2024 data in next either February or March, and then another webinar in the summer, and then we will be having a webinar this fall as well. So next steps, we will be improving the accessibility and usability of the site. And there is actually, when you sign in for an account, a place where you can opt in to become a user tester. Please help us make this site better and better for everybody. And also as a way to let us know what you'd like to see coming up. And here are, oh, Dan, please take it away. This is you.
Sure. So on the screen now, you will see the social media handles for both the Harkin Institute and the Northeast ADA Center. So please, if this conversation was valuable to you, feel free to engage with both of our organizations going forward. As Camille said, they regularly are putting out content, as are we at the Harkin Institute. Hopefully, this is the first of many future collaborations between our two organizations as well. So follow us on social media, sign up for our listservs. Um, and I also want to highlight, Camille and Bill helped me with these scenarios and going through some of these data points, but know that there is so much more that you could do with this website and so many more, congressional district data and different demographics and things that you can search. But with 1 hour, we really tried to streamline it into some commonly occurring scenarios. So please log in, make your profile for disabilitystatistics.org and start querying, start searching, including higher quality data in all of our disability work helps us keep moving forward and um, advancing to make a world that is more accessible for everyone. So that gets us to our hour here central. Thank you all for joining us today. Thank you, Bill and Camille. I want to thank our captioner for being here today, to thank all of you for attending, and happy Disability Pride Month, everyone.
Thank you, everyone.
Thank you. Bye.